chances are the medicine in your cabinet right now was made in India. Whether it's a fever reducer, a blood pressure pill, or an antibiotic. Statistically, there's a good chance it started in an Indian factory. And over the past few years, that same country has also been at the center of some of the world's worst medicine safety failures. In Africa, in Central Asia, and at home. Different products, different years, different regulators on different continents, raising the same alarm. So here's the question this video is actually about. Why does one country keep appearing again and again in stories about medicines that went wrong? To understand why, you first have to understand how much the world depends on India to begin with. India makes more generic medicines than any other country on Earth. Cheaper versions of drugs that would otherwise cost far more. According to the World Health Organization, roughly 60% of the medicines it pre-qualifies for global use come from India. When COVID-19 hit, that capacity became a lifeline. India didn't just vaccinate its own population, it shipped hundreds of millions of vaccine doses to nearly 100 other countries, many of which couldn't produce vaccines themselves. This is sometimes called the pharmacy of the world, and for good reason, which makes what comes next harder to reconcile. How does a system this capable, this essential, also keep producing failures that cost lives? In 2025, in the Indian state of Madhya Pradesh, at least 26 children died after taking a cough syrup, a case still under investigation, and one worth treating carefully rather than definitively. What is confirmed by the World Health Organization is contamination linked to that product, and a manufacturing halt that followed. This wasn't an isolated case. In 2022, WHO issued a similar alert after children died in the Gambia. 66 confirmed deaths, by WHO's own retrospective count, traced to contaminated cough syrup made by an Indian manufacturer. The contamination wasn't some exotic toxin. It was diethylene glycol and ethylene glycol, industrial solvents, sometimes used in antifreeze, that in these cases had been substituted for a safer ingredient, likely to cut cost. In the human body, they attack the kidneys. That's what killed those children. Not an infection, not a virus, but their own kidneys shutting down from what was supposed to be medicine. In 2023, it happened again, this time in Uzbekistan. Same contaminants, same mechanism, a different country, a different year, the same preventable cause. And it isn't limited to syrup. The US FDA has issued its own warnings about Indian manufacturing facilities, covering tablets and injectable drugs too. Different products entirely, different regulators, different continents, all pointing at some of the same underlying problems. To understand how failures like these actually happen, it helps to see the whole path a medicine takes before it reaches a patient. It starts with raw ingredients, sourced from a supplier and checked against a certificate. Those ingredients go into manufacturing. A sample gets pulled and sent to a lab. The results get written down, a record meant to prove the batch is safe. A quality reviewer looks at that record and decides, release it or reject it. If released, a regulator is supposed to have already inspected the facility that made it. From there, it's exported, shipped to a pharmacy or hospital, and finally reaches a patient. Ingredient, supplier, manufacturing, testing, records, release, regulator, export, pharmacy, patient. 10 checkpoints. And what official investigations have found is that in specific identified cases, one or more of them didn't work the way they were supposed to. In Madhya Pradesh, WHO's findings centered on contamination, followed by a production halt and recall. In the Gambia, WHO lab testing confirmed the same category of contamination at a facility whose own paperwork claimed a different, safer ingredient. And at facilities inspected directly by the US FDA, warning letters described problems at an earlier stage entirely. Inadequate cleaning procedures, unreliable testing records, and in at least one case, results quietly changed after the fact. Worth being precise here. These findings are specific to the facilities named in each case, not evidence about the Indian pharmaceutical industry as a whole, which manufactures for most of the world without incident. In 2026, Indian regulators conducted a nationwide inspection drive of their own, examining more than 960 facilities identified as higher risk and taking action at close to 860 of them. That's not proof of an industry-wide crisis. But it is India's own regulators acknowledging that risk is concentrated somewhere, and that oversight wasn't always catching it in time. So what do we actually know? Contamination happened repeatedly across 7 separate verified cases. Gambia, Uzbekistan, and India's own regulators flagging failures as recently as this year. Real, documented failures in manufacturing controls, in testing, in record-keeping. Regulators, including India's own, have taken action after the fact, not before. What we don't know, and what these investigations don't establish, is intent. Whether warning signs were missed by mistake, or in some cases, noticed and ignored, that remains unresolved, at least in what's publicly documented. What is certain is this: the world built a system that depends enormously on one country's manufacturing capacity, because it's capable and because it's affordable. That dependence has saved lives at massive scale. But it also means that when something goes wrong inside that system, the consequences don't stay local. They cross borders, sometimes as fast as the medicines themselves. Thanks for watching. If this helped make sense of it, like, share, and subscribe, and hit the bell for what's next.